So, I am very proud to introduce the keynote speaker for our Flight of the Phoenix Summit. I cannot think of a better person to help us take off to a bright future with promise. You all know the NLN's fabulous CEO, Dr. Beverly Malone. You know that she is among America's most vocal leaders in the conversation about nursing and the nurse educator shortage, and the role of nursing in ensuring access to safe, quality, culturally competent care to diverse patient populations, both domestically and globally. You know she's an innovative leader and committed to, as we say in the NLN mission, promoting the excellence of nursing education to build a strong and diverse nursing workforce to advance the nation of the health of our, to advance the health of the nation and the global community. You know all that, but please allow me to review some of the highlights of Bev's very inspiring career. Since February 2007, when Bev's tenure at the NLN began, the League has been distinguished by a retooling of our mission to reflect the core values of caring, diversity, integrity, and excellence, and an ongoing focus on advancing the nation's health. Bev's activities, and therefore her influence, has extended well beyond nursing education to many other arenas that affect the health care of millions, including public policy, global health, access to quality health care by those underserved in both rural and urban poor, and improved care for the elderly and veterans. The significant faculty development and leadership initiatives Bev champions, from the NLN Academy of Nursing Education to the International Council of Nurses Education Network. These highlight her commitment to prepare that diverse nursing workforce we speak about, nurses that care for patients to the full extent of their practice. Under Bev's guidance, the NLN has partnered with corporations, associations, and foundations, ranging from Walters Clore Health and Laerdal Medical Corporation to AARP and the Robert Wood Johnson Foundation, to advance the science of nursing education, to increase diversity in nursing and nursing education, and to advance excellence in the care for vulnerable populations. Her testimony in 2009 during congressional budget hearings was but one example of her public policy advocacy for increased support for nursing workforce development and advanced education for nurse educators to address the persistent shortage of nurses that threatens health care delivery. Bev is among the 70 professionals in nursing, medicine, public health, and related fields of health care recognized by the Institute of Medicine for outstanding contributions to the advancement of medicine, medical science, and public health. That recognition came in the form of an election to the Institute last fall. So Bev joined 1,966 people who hold membership in the IOM since its creation in the 70s by the National Academy of Sciences as an advisory council. She also serves on the Advisory Committee on Minority Health, a federal panel established to advise the U.S. Secretary of Health and Human Services. She is the vice chair of the Nurse Family Partnership Board and a member of the board of the Kaiser Family Foundation. Her latest book, Diversity and Cultural Competence in Healthcare, was released last year. There's much, much more, of course, but I don't want to keep you waiting a moment longer. So without further ado, please join me in welcoming our keynote speaker, Dr. Beverly Malone.
Thank you for that. It seems like I should quit while I'm ahead and just sit down. But I do have a speech to give. Colleagues, let me begin by formally acknowledging our president, Dr. Marsha Howell Adams. And if you notice, we cross Adams Street when we come. Have you noticed that? The stars are aligned. I left her side only a few minutes ago, and it is truly a pleasure to work with her, along with our outstanding Board of Governors and a brilliant staff. I have the privilege of sharing with you the amazing journey of the National League for Nursing. I will not dare to cover all 121 years. I'm only going to speak to the last 2 years or so. Already you can see the picture. Nothing really only occurs in the last 2 years of a historic 121-year period of time. It's a building process embedded in the belief that we stand on the shoulders of giants. This flight of the Phoenix was designed and preordained in the dreams of those leaders, presidents, and CEOs, boards of governors, and staff that predate us. In our opening, we mentioned our living presidents, and I also want to acknowledge CEOs, Pam Moraldo, Pat Messia, and with special appreciation to Ruth Cochran, my immediate predecessor, and the CEO who saw the NLN through some very difficult times. However, you and I both know every CEO is blessed with some difficult times, just to keep things interesting. So on to this particular part of the NLN journey. Let me begin with the first time a move to DC was discussed with me. At my hiring, President Tony Bargalotti, in a Tony Bargalotti way, asked if I would be willing to think about moving the organization to Washington, DC. This was something the board had been considering and thought it could be a good move for the organization. I responded in the affirmative, but countered with the reality that it may take quite a bit of time for the organization to be ready for such a major move. And in my mind, I thought, what was there not to love about New York City? It wouldn't be until May 2009 that the NLN Board of Governors actually voted to move the entire organization to Washington, D.C. Not the outskirts, but into the heart of the city. I remember sending out a scouting party composed of the Chief Administration Officer, the Chief Financial Officer, and the Director of the Office of the CEO. You know them as Linda Christensen, Steve Cerami, and Mike Christic. It was after one of their scouting expeditions that Linda came back and reported that the realtor had asked her, "What was your vision for the move?" And Linda, lawyer, nurse, and educator, thought this was a good question for the CEO. I was dumbfounded, or as the Brits say, gobsmacked. I quickly recovered and said, "You have to remember, I'm from Kentucky. When we move, we just pick up from one place and we set down in another place. We have moved. No vision is involved." but it hung around in my head and my heart that I did not have a vision. It was soon after that encounter that I went on my annual holiday to Aruba, where the sun shines even through the rain and the breeze from the trade winds are so calming that even nurses can find themselves relaxing. Well, colleagues, I experienced a full-blown vision of where and how we, the NLN, needed to go with the move and how we together would make our vision real. The League would become the NLN home for transformative excellence through purpose, power, and passion. Not bad for a relaxing day on the beach. But first, just a quick definition of transformation. If I give you $1 and you give me back 4 quarters, you have given me change. Thank you very much. But if I give you $1 and you give me back $5, we have transformed the situation. The National League for Nursing is not looking for change, but for transformation. Our purpose was our mission statement: promote excellence in nursing education, to build a strong and diverse nursing workforce, to advance the health of the nation and the global community. At that time, the mission statement was full stop after the phrase, building the strong and diverse nursing workforce, period. If we educated them, that should be enough. With the wisdom and foresight of our Board of Governors, the mission statement has been revised twice. Once to add 5 little words to advance the nation's health. You see, in order to bridge the gap between education and practice, or in other words, not just drop our students off at the curb once they've been educated, but to appreciate that unless we advance the nation's health with each well-prepared student, we have not completed our jobs as educators. And there's no way to advance the nation's health without our practice colleagues. I told you we have a brilliant Board of Governors. The second revision happened just this year when the board added the global community to our mission statement. One may contend that it was always there in the subtext, but we wanted it highlighted and announced to our colleagues throughout the world that the National League for Nursing is in the caring business that extends beyond the borders of the United States. The mission statement is a great example of the flight of the phoenix, building on the foundation of the past, starting with where NLN was, promote excellence in nursing education, to build a strong and diverse nursing workforce. The lens widened with the addition of to advance the nation's health, and then the sphere of influence reframed and magnified with the addition of and the global community. And so I'm pleased to share with you the following. Education and caring are related. For the NLN has 4 dynamic, interrelated core values that permeate the organization and provide that foundation for all we do and all we choose not to do. They are caring, integrity, diversity, and excellence. Let me share with you an image that represents their importance to the League. Please visualize this along with me. The elevator doors open onto the 8th floor of the Watergate, that historic edifice in our nation's capital, and you step out into the gleaming headquarters of the National League for Nursing. Through the entryway, you can already see the glass doors of the conference room. On them are etched 4 words: caring, integrity, diversity, and excellence. These are the values we aspire to live every day, the values that undergird our mission, and together with the mission comprise the purpose. That is the foundation of our NLN Home for Transformative Excellence. Here are the core value definitions: caring, promoting health, healing, and hope in response to the human condition. I think we have all become clear that what we desire is a health system and not one based on illness. And healing is such a natural part of being a nurse. If my forefathers and mothers had not crossed the seas in a less than luxury conveyance, I would be in somebody's village crying, "I'm the village healer. I am the village healer." It's in my blood. And it has allowed me to be a psychiatric mental health nurse extraordinaire. I have to admit it. And then there's hope. Hope is a sought-after commodity, but we as nurses should not wait until we get to a patient care encounter to inquire, did anyone bring some hope with them? We should have a self-generating mechanism of hope with us at all times. We care. Integrity is the next one. Respecting the dignity and moral wholeness of every person without condition or limitation. The esteemed psychologist Carl Rogers used to speak about unconditional regard, basically suggesting that if you are breathing, you should be respected. And with nursing, even if you're not breathing, you garner our respect. This is who we are as nurses. This is how we roll. Next is diversity, affirming the uniqueness of and differences among persons, ideas, values, and ethnicities. This is the idea of inclusion that transcends all of our usual suspects into diverse ideas and values. It's not to deny the unique history of the United States in terms of racial issues that are still alive and well in various ways, but it is to acknowledge that we have to think in different ways for a different time, that old, outdated arguments are of no use to nursing. We are incredibly good at sustaining an argument for an indeterminate period of time. Have you noticed? Simply stated, diversity brings complexity. I have come to believe that without diversity and all its complexity, there can be no excellence. Excellence is the fourth core value, and its definition is probably one of my favorite: co-creating and implementing transformative strategies with daring ingenuity. Wow. Once again, our Board of Governors, in their annual review of our mission and values, delivered on wisdom by adding 2 letters to our definition of excellence. The 2 letters are C and O, thereby changing creating to co-creating, clarifying that no one actually creates alone, and that true excellence is the result of some level of collaboration. And what is this idea of excellence as if it's a permanent fixture? I know some faculty who received a teaching award in 1998, and thereby have refused to change their syllabus, it was perfect then. Why mess with perfection? And finally, this idea of daring ingenuity. For me, it's simply falling off a cliff. When you are in the business of transformation, there is bound to be some cliff behavior. And if one has time to anticipate the cliff, to arrive early and put a safety net across the chasm, everyone will then proclaim, "Did you see how lovely Beverly just floated off that cliff?" But in a transformational flow, sometimes there are not enough time to anticipate the cliff, and one just has to fall ugly. But it's never been about the falling. Falling is inevitable. It's always been about how one gets up. These are the NLN core values. Remember? Caring, integrity, diversity, and excellence. And those, along with our mission statement, they comprise our purpose for the home for transformative excellence. So, first comes purpose, and then power. Power is the engine driving the transformation of the NLN. It's composed of 121 years of dedication to the profession of nursing through education. It's our 1,200 plus agency members and 40,000 individual members, representing a portrait of inclusivity with nurse faculty and leaders in all types of nursing programs across the entire spectrum, from the beloved LPN, LVN to the RN with doctoral preparation. Power can be felt in our 26 constituent leagues, showing the face of the NLN in our states. Our Academy of Nursing Education Fellows, our certified nurse educators with their hot red bags, faculty from NLN Centers of Excellence, our strategic steering committee, the almost 900 NLN ambassadors in both member and non-member schools of nursing that I call my ninja team. And of course, our leader among leaders, the NLN Board of Governors. And to round out the power principle, the move to our nation's capital, a unique combination of potential national and international partners, as well as the location of the seat of healthcare policy making, is most definitely a major power move. Now we have purpose, power, and so where's the passion to accomplish this transformation of the NLN? Our passion is connected to and aligned with the IOM, Institute of Medicine, Robert Wood Johnson Foundation Future of Nursing Report, as are our 7 NLN Centers for Nursing Education. In Aruba, my vision encompassed only 6 centers. The 7th was academic and clinical transitions. It arrived toward the end of that same year, wrapped in Christmas paper designed by Laerdal Medical, and implemented in partnership with Walters Clears Health and Laerdal. The 7 NLN centers are transformational leadership, vulnerable populations, this is number 2. Number 3, diversity and global initiatives. Number 4, innovation in simulation and technology. Number 5, assessment and evaluation. Number 6, the NLN Chamberlain Center for the Advancement of the Science of Nursing Education. And number 7, academic and clinical transitions. Keep in mind the definition of transformation. It's a continuing process of growth and continuous improvement. So, for example, the originally named Center for Excellence in the Care of Older Adults is now the Center for Excellence in the Care of Vulnerable Populations. That, of course, still includes older adults, but now also includes veterans, Alzheimer's patients, children, and others. So what was the next step in this unfolding vision? The reality of funding our centers. Wake up, Malone. Supporting the passion that provides space for member engagement in new packages, new products. At one time, it seemed that the primary method for member engagement was election to a council. Our councils accomplished some amazing work, and yet they varied in their output. Some moved at a snail's pace when the 21st century demanded an NLN that was nimble. As if in preparation for the move, our Board of Governors boldly redesigned member engagement to become think tanks and strategic action groups with clearly identified boundaries of task and time. We found so many of our colleagues willing to engage in time-limited initiatives with a clearly identified outcome. We also developed a strategic steering committee that provides guidance to the leadership of the Board of Governors and to the staff, appraising our efforts and direction with forthright directness, holding us accountable to our mission and core values. But let us return to the how. How do we provide resources for the passion, the 7 centers? Well, we initiated a major campaign for the NLN Home for Transformative Excellence, and we thank many of you for your contributions. And by the way, it is not too late to give. But at the outset, the Center for Innovation in Simulation and Technology and the Center for Clinical and Academic Transitions were envisioned to provide collaborative partnerships with industry, our corporate colleagues. We, the NLN, yearned to showcase new products of technological advances for nursing education. Our annual technology conference is now co-sponsored with Elsevier. The Accelerating to Practice initiative, also lovingly known as A2P, with Laerdal Medical and Wolters Kluwer's Health, became a 3-way collaboration to develop a product to facilitate the transition of new nurses to the hospital clinical staff role. The product, which is being developed over the next year, will be more efficient, take less time, and be more cost-effective than other products currently on the market. Wow! Another way we are using our expertise in nursing education to influence practice and advance the nation's health. Exciting, and yes, an additional revenue stream for the NLN and an additional resource for the nursing community. The development of the virtual sim product is another example. We are taking our current simulation scenarios, again in collaboration with Laerdal Medical and Wolters Kluwer's Health, and adapting them to the virtual world, creating a product that has already received high marks from our pilot schools. There will be a charge for VSIM, and the NLN revenue will go back to the NLN coffers so that we can continue to devise and produce products, some of them at no cost to you, such as advancing care excellence, teaching strategies, and unfolding cases, free resources that enhance your ability to engage students and help them to think like a nurse. And then consider the recent report of the amazing NCSBN study on simulation. Once again, the NLN is thinking of new ways to be supportive of our members. In collaboration with Laerdal Medical and Wolters Kluwer's Health, we are co-creating a range of resources to make integrating simulation into your curricula easier. So you see, colleagues, we are dramatically moving from not only showcasing new products, but to developing and refining products. As the NLN grows, our vision grows. We are very clear that this transformed NLN needs to provide new revenue streams that offset the ever-increasing pace of dues. We want our member schools to have a leveling of dues stability and not be expected to unreasonably escalate those dues with rising NLN cost and new technologies. On the beach in Aruba, economics did not have a place in the vision. But with the vision's implementation, financials were required. As we considered our passion and 7 centers and their partial funding through collaborative partnerships with industry, universities, colleges, and foundations, we began to realize that the NLN had crossed a major boundary, no longer exclusively a classic not-for-profit organization. While still a 501c3, the League was evolving into a unique, non-profit with varied production streams, providing revenue that is reinvested into the organization to actualize the mission of the NLN. Just in case you forgot, promoting excellence in nursing education to build a strong and diverse nursing workforce to advance the health of the nation and the global community. Long before the move to DC, our testing services department embodied that reinvestment ideal. When a school's faculty decided to buy NLN tests, they knew that the money they spent went back into the coffers dedicated to faculty and leadership development. Now testing has been joined by an array of financial revenue streams that will be generated for the good of nurse faculty and leaders. This is the new form, the new face of the NLN. The move, the relocation, instigated this transformation. This is the new journey for the 21st century. To be nimble, technologically advanced, and have diverse revenue streams that include dues, but do not exclusively rely on them to meet the needs of our members and the greater healthcare community, including global. In addition to the 7 centers and aligned with the NLN being a home for transformative excellence, our move to Washington, D.C. has brought with it the founding of a new accrediting division. The NLN Commission for Nursing Education Accreditation, CNEA, established last year at your request and your vote, thank you very much. The Commission for Nursing Education Accreditation provides nursing programs of all types with an accreditation option based on the core values of the NLN and respecting the diversity of programs, mission, curricula, students, and faculty. During this past year, the CNEA Steering Committee has been guiding the development of this new division, and the CNEA Standards Committee has been busy writing accreditation standards that are focused on quality assurance in nursing education within a culture of continuous quality improvement. Over the next few months, look for opportunities to provide feedback on the accreditation standards with a target date of spring 2015 for their publication. It's incredibly exciting, and one could posit that we have just awakened, like Alice in Wonderland, to find ourselves in this new day for transforming the NLN. But the reality is, our board has been dreaming of and gently pushing toward the DC move and all it represents for at least 6 years prior to making it real. The reality is that members of my exquisite team have worked for the Gillette Corporation, practiced law with an incredible ability for making contracts simple and readable. Can you believe it? Performed as master teachers. I'm talking about my staff right now, in case you're wondering. Deans they've been and provosts of universities, worked with the finances of corporate America, assembled a star-studded communications and marketing squad, and served globally and locally with an understanding of diverse cultures and the humility that is required to be accepted in an international setting. My team, my staff, they are quick learners as well as great teachers. My team is adapting and adopting the new, to us, corporate lingo, but staying true to our core values as the voice for nursing education throughout the country and around the world. The possibilities are unending, and I am honored to be a part of the NLN. I'm just a resource to be used. Use me up. A colleague to be shared. A nurse who knows that nurse educators are the key and treasure in partnership with our clinical colleagues from various disciplines to advancing the health of the nation and the global community. We have our North Star: quality, patient, people-centered care. And we can see it in the skies of Washington, D.C. Colleagues, together, let's stay focused on the prize. Thank you.
I think we need to applaud one more time, because I'd say wonderful. Okay, folks, hang in with me here. We've got some announcements to make, and this is important information that you will find useful as you navigate your way through the summit. While there are too many summit highlights to list them all right now, we would like to highlight some of the major ones. So we want to kind of whet your appetite for your experiences to come over the next couple of days. On Thursday morning's plenary session will feature Lee Cockrell, the former senior operations executive for the Walt Disney World Resort, who will present You Can Create Disney Magic Too. At plenary session 2 on Thursday afternoon, we will also be fortunate to have the National Council's Chief Officer for Nursing Regulation, Dr. Marianne Alexander. With us, she will present and discuss the newly released results of the National Council's National Simulation Research Study. The project director, Jennifer Hayden, will not be able to be with us. She is ill, and we hope that she will have a speedy recovery. On Friday morning is the National Faculty Meeting, and it will continue to serve as a town hall, giving you a chance to discuss accreditation, the simulation study, the new vision statement for LPN LVNs, and other issues of common concern. And you'll be able to converse with the Board of Governors. And I encourage you to think about your concerns and your questions that you may have so that you can come forward at the faculty meeting and bring it to the forefront, because I think that we learn from each other. Wouldn't you agree? On Friday, don't forget the wide array of special sessions from 3:30 to 5. There's no pre-registration necessary, and there are 10 sessions which will range from, does your financial future have a pulse? Now here, you will get personalized advice from Merrill Lynch Senior Vice President, Wealth Management, Don Shuck. And I have to tell you, he's wonderful. Also, we will be talking about recognizing excellence in schools, healthcare organizations, and individuals, where you will learn about the process for Center of Excellence designation and for fellowship in the Academy of Nursing Education from faculty that are associated with each of these programs. The President's Reception and NLN Banquet on Friday evening will celebrate the induction of the new fellows in the NLN Academy of Nursing Education and the new group of NLN Centers of Excellence. Again, at the banquet, the prestigious NLN President's Award will be bestowed to Dr. Polly Bednash, who has recently retired as the CEO of AACN. Reasoning and practice education, debriefing in, on, and beyond simulation. This will be the 2014 Spunt Lecture, which will be delivered by Dr. Christina Thomas Dreyfus. And before we close this particular session, I'd like to share some critical logistical information with you. Now, doesn't that sound important? Okay, now, so you better listen closely, because things have really changed in relation to continuing education credit. Actually, the process was revised in 2013 by the International Association of Continuing Education and Training, the agency that approves the NLN as a provider of continuing education. We use their criteria and guidelines as the basis for planning our continuing education programs. The new 2013 standard requires that we take attendance for each session. Sounds like you're in class, right? In order to be in compliance, the NLN has added a barcode. So if you'll look at your name tag, you will see a barcode on your name tag. And so those particular badges that you're wearing around your neck will be scanned by a moderator as you enter the various sessions. Your continuing education survey will be based on the sessions you selected to attend. So that's real important that you get scanned when you walk into the room. In addition, all presentations that confer continuing education credits will now include conflict disclosure statements from the presenters. So instructions to receive your CEUs are included on a flyer available at the registration desk. By October 1, you will receive an email that will be sent to the same email address that you used to register for the summit, and it will contain a link to an online evaluation. Once you complete the evaluation, you will be guided to your certificate. As you know, there are many lunchtime activities during the summit. Now, this is very important. You must pick up your box lunches in the exhibit hall prior to going to any of these events. Now, they have asked me to emphasize this, so I will say it one more time. If you are going to a meeting that is scheduled during lunch, what are you going to do first? Pick up that box lunch and then head to your meeting. Now, after all that, there is one exception. If you are an Academy Fellow attending a special luncheon on Friday, do not pick up your box lunch. Lunch will be served. Also, we ask that you not miss our book signing on Thursday morning. Editor Linda Caputi will be at the Walters Clear Health booth from 7:45 to 8:15 to sign copies of the recently published Volume 2 of Innovations in Nursing Education, Building the Future of Nursing. It is very exciting that the summit is so well attended. What that means, however, is that some concurrent sessions are full. These full sessions will not have additional seating. All concurrent sessions require attendees to have their name badge scanned at the door. Once room capacity is reached, no further attendees can be permitted. This will keep us in compliance with all fire and safety regulations. And really, we do appreciate your understanding about this if you are unable to get into a session that is already sold out. But there are many sessions, and so we hope that if you aren't able to get into one, you'll be able to get into others. For those planning to attend the banquet on Friday evening, remember to visit the registration desk and exchange your banquet voucher for an admission ticket by noon tomorrow. Your voucher is included in your registration envelope. We also ask that if your plans change during the week and you no longer intend to attend the banquet, that you return your ticket to the registration desk, because this helps us to plan the correct number of people. Finally, we have a lot going on this week. While most functions will take place here in the Convention Center, we also have several workshops and meetings taking place on the second level of the Hyatt, which is right across the street. So please refer to your pocket program guide for all room names and locations. And always remember that if you have any questions or concerns, please let one of the NLN staff know, and they have name tags that identify themselves. We want your experience here at the summit to be flawless, and we are so happy that you're here and so excited about all the many sessions that our peers are offering, and I am just excited. So I welcome you to the NLN Educational Summit. I know you're dying to get to the food, wine, and exhibitors, and so I say onward. The flight of the Phoenix continues. Have a wonderful evening.